Good morning. I'm here with a couple of longtime colleagues and national experts on how we prevent obesity and other diseases related to an unhealthy diet. One of the things we know about our diet is that it's driven by an unhealthy food environment, and that means the solution to these problems is to create a healthier food environment. So first, let me turn to you, Margo. You've been involved in federal food policy for years. Tell us something about some of the big wins we've had in the past in creating a healthy food environment and maybe some future wins.
Well, we're actually making some good initial progress. We have gotten trans fat out of the food supply. We've brought nutrition into the restaurant setting by requiring calories to be posted on menus and menu boards. And we have gotten an update to the nutrition facts label so that added sugars and a daily value are listed so that people can see that just one Coke has more than your whole day's budget for added sugars. Now, probably some of you are thinking like, oh yeah, you got these things done during the Obama administration, but things have changed a little bit in Washington, D.C. over the last couple of years. But it's important to keep in mind that for all of these policies, we were laying the groundwork long before President Obama was elected. So with school foods, we were working on state and local policies, litigating against the soft drink industry for having soda in schools, and building a coalition so that when that moment in time came where we could pass a national policy, we were able to pass the Healthy Hunger Free Kids Act. So next up is we've got to focus on grocery stores where people get 2/3 of their calories. Grocery stores are pushing unhealthy food on people, especially in low-income neighborhoods. We've got to deal with restaurant food, which is the next biggest source of calories for people, focusing first on kids' meals. And we've passed over a dozen policies to get soda and sugary drinks off menus at kids' meals. But we've got to keep working on that until restaurant foods really provide healthy options for families.
Okay, great. Sonia, you were involved in an initiative to address salt, which is now expanding. Tell us about the NSRI, what it's done, and where it's going.
Right. So the National Salt Reduction Initiative was established in 2008. And really, at that time, we were trying in New York City to think about how do we address hypertension, and in particular, how do we get sodium down in the diets of New Yorkers? We know that 3/4 of the sodium in our diet is actually not what we're adding at the table. It's already in the foods. It's this unhealthy food environment that you're both referring to. The challenge, though, is that the food supply is national for processed and packaged foods, not local, and so the change needs to be national. So what we did, at that time, the federal government really wasn't interested in acting on sodium. So we thought, look, this is not a problem that's just in New York City. This is a problem we all share, and we started reaching out to other counties and states and health organizations, and we created a national partnership of organizations, and together we created a database, set targets for sodium reduction for industry, and then went to industry and got commitments and secured them. And then we monitored changes in the food supply over time, and we found about a 7% reduction in the amount of sodium in our food. So we realized, hey, we've got a model that works here. Now, we've been very fortunate, and the issue around sodium has now been adopted by the FDA, and we're really pleased that they're moving forward with a model similar to the National Salt Reduction Initiative, which means we can back off from that. So we thought, hey, sugar, that's a huge problem, right? 68% of packaged foods that we purchase have added sugar in them. We can't exercise healthy choices if we don't have healthy choices. We want to put choice back in the hands of all of us so that we can have healthy diets. So we are starting up again, and now the National Salt Reduction Initiative is now called the National Salt and Sugar Reduction Initiative. And we're doing it again. And so we've set targets, and we're out there, and the preliminary targets are out, and we're moving forward, and we'll be seeking commitments soon. So we're excited about it.
So exciting, the idea of taking that model, which is shown to be working, and expand it to another ingredient that is really unhealthy.
That's right.
I want to chime in here on one initiative we've done in Philadelphia to address sugar consumption, and that is the Philadelphia Beverage Tax. We know that if you raise the price of something, yes, thank you. I'm at least that enthusiastic about it. Tax was passed in 2016 on distributors, 1.5 cents per ounce, with the idea if you raise the price, people will choose healthier beverages. This tax has been a big win all around. Overall, we've seen a reduction in sales of sugary drinks. Our surveys are showing a reduction in consumption of about 35 to 40%. The tax is generating $75 million a year to the city of Philadelphia, which the mayor is using to provide pre-K for low-income children. Now 2,700 kids are getting pre-K as a result of that. And to rebuild our parks and recreation centers, which is, to me, a physical activity initiative. This is something that, thank you. As you might imagine, the soda companies don't like this at all. And they made a bunch of claims about it that really weren't true as far as the economic impact. We've measured it. There's been no decline whatsoever in employment in the grocery store industry. There's been continued growth overall in the food and beverage industry. So no negative economic impact. The tax is a big win all around. So we have a number of examples of things that have been successful. What sort of lessons do you think, Margo, we should take from those about what we should be doing on our food environment in the future?
Well, I think one of the big ones at this time where people tend to not have a lot of hope about federal policy is that we can and have changed policies. It is possible. We've done it at the national level, at the state level, at the local level, and at the corporate level. And so the industry often opposes, okay, maybe always opposes pretty much everything that I've worked on, and they say that it's impossible, it'll cost too much, it'll kill jobs. They cry wolf regularly. But if we work together, we can overcome that opposition. And I think we need to work together, not just here in the US, but globally, right? Companies are multinational, we need to be as well, and to learn from each other, to share successes on tactics, on messaging, and to try to increase the number of policies that we're able to adopt and to achieve them more quickly.
Okay, great. Sonia, what are your lessons that you draw from all these?
Yeah, well, I would echo this need for a global learning community because it's from one another and the evidence that we have in the things that we implement that we learn how to innovate on top of that and spread. So absolutely, and that's what really this is all about as well. Another really important lesson for us is to be just laser sharp in our focus. We focused first on sodium. We did it. We think we did it well. We had a model that worked, so we moved on to sugar. That's been really important for sort of building through the process of really changing the food supply at large. And the last thing I want to comment on is data and measurement. It's really important for us to have evaluation processes in place to be sure that what we're doing works. If it doesn't, we shouldn't be afraid to retreat and redirect our resources in other directions because we have very finite resources in public health. We have to use them well. Another reason, though, why we must measure is that we have to move towards an equitable and fair and just food environment and really make sure that the changes that we're making benefit not only overall, but that all of our populations are brought up by these efforts and we leave nobody behind. So the other key piece is measurement to document and show that what we're doing is the right thing.
Yeah, well, certainly low-income people here face an unhealthy food environment. One of the lessons I think I would draw from this is that at first when you think about a food environment, it's so incredibly complicated with tens of thousands or hundreds of thousands of products, many, many different channels that are diversifying every day. It feels impossible for us to have any impact on them. But if you have a real focus on those areas where the data says they're going to have the greatest impact, and you really target on those, work very seriously on those, you can make an impact. And cumulatively across all the different initiatives on salt and sugar, on menu labeling, that sort of things, the overall food environment changes and people's diets will be healthier.
Absolutely. I think oftentimes in public health, we're do-gooders, right? We want to change everything. There's lots of ways that we can help to enrich people's lives, and it can be overwhelming. But choosing those areas of focus and then sticking with them for the long time is the recipe for success.
Okay, great. We're out of time. Thanks very much, and let's get back to work.